Shravananda, then Sahaja.
Hey, Shravananda.
Hi, Greg. Hi,
Hey,
Sam.
hey. How are you?
I think I'm doing pretty good.
Good.
I just had a question about myself and then one about my grandmother.
Okay.
So, I'm taking ANS support internally
Okay.
and lemongrass internally, and I added the Yingling across my diaphragm.
Oh, nice. Like good combo.
And still doing marjoram across my chest and diaphragm, and and the pepper on my neck and chest. So those tight spaces from the diagram that you shared.
Mm-hmm.
Okay.
So you got the sides, the
Yeah.
sides. Okay.
Yeah.
So
Yeah.
how is that going? I'm curious.
So I feel like it's going well, but it's super slow.
Mhm.
And I had you had suggested that maybe I get the ribs adjusted. So I went to a chiropractor for the first time in 10 years, and I got that done.
And how did that treat you?
So I feel like I have more space to breathe, and the pain is like 0. Like it was
Okay.
at least a 2 out of 10 every day, at least.
Right.
And so the pain is 0, but I'm still getting, like, the air still gets stuck across the mid sternum. And I actually just went to the pulmonologist today, and he said, your lungs are clear, your bronchioles are clear. And he's wondering if it's not more of a GI thing where my diaphragm, the muscles in my diaphragm, or not my diaphragm, my muscles in my esophagus are tight.
Mm-hmm.
And so then that spasm goes down to the sternum, but he's totally guessing.
Yeah. Well, I mean, that's actually a pretty solid guess. I mean, that you're having that issue. The other thing that is always a potential, because you can kind of tell, like, when you do this week to week, there's some things where I'm like, oh, I totally know what that is. And then there's other times where I'm like, we got to start treating it. And like the treatment is like part diagnosis or evaluation and part like treatment. Like you just start like treating things and you go, okay, how does this respond? Like what's going on? And you start engaging the process, and you just start like ticking things off the list. Like, what about this? What about that? And, even with being able to look at things energetically and scanning and clairvoyance, still sometimes there's so many factors going into something that it's hard to say, this is what it is.
Yeah.
And you've ticked off a lot of things on the list, and like when he looks at your lungs, they're clear. So that's like good, because you're still having an issue, but how much of it is truly the respiratory tract now is starting to be like, not sure about that. So trachea would be one. The other one is, you're doing things to unwind the diaphragm and the gut and all of that, and that can be quite helpful. The other thing to throw into that mix is the vocal cords. And the vocal cords often get overlooked with respiratory type issues, but sometimes it does this thing where, remind me, were we treating paradoxical breathing in you like a while back?
Yeah, at the beginning.
Was that you?
Yeah.
Okay.
Yeah.
So there's a thing called paradoxical vocal cord syndrome, and it's the same thing. Like it closes when it should open, and then when it's open, it should close, and so it throws the breath off. And a lot of times the person will present with respiratory distress or asthma or something going on, and the respiratory tract looks fine, they go through, they do all the testing, everything's fine. And so then you start going, okay, what else could this be? And sometimes it is the vocal cord syndrome. And so let's just look at it from the point of what you have in your tool chest at home. Let's not have you do anything extra. Let's just see what you got. So in the form of like chamomiles or yarrows, or even potentially Melissa, what do you have out of any of them?
I have Melissa, I have German chamomile, and I have yarrow.
So let's have you do. You know what I would do? I would put a drop of each one of those into like a little glass of water, gargle a couple of times with a little bit of the water, and then just slowly sip and drink the rest of that water and let it just wash down that vocal cord or down your throat. That will impact the vocal cord. Do that like 3 days in a row. And let's see if that changes the respiratory thing. Melissa does this really weird thing. So the German chamomile and the yarrow are helping to reduce inflammation, which is tied to sometimes some of the paradoxical issues that happen in the brain or in the neck or in muscles. But also the yarrow and the German chamomile help to re-educate the nerve somewhat. And so, it doesn't do it immediately, but like if you just kind of keep putting some of the oil on that area, it will take the nerve from being super dysfunctional and basically make it go down the right pathway. Because the thing that happens with the nerve is like, let's say it's the paradoxical vocal cord syndrome. The issue could have been like 3 years ago. And then the issue diminishes and goes away, but the nerve, every time it fired down that pathway, becomes easier and easier for it to go down that pathway. And so then after whatever the situation was that clears up, your nerve is firing down the wrong pathway, and it doesn't go like, okay, let's go back to the way that it was. It doesn't do that. Like it just stays firing in the way that it's been firing over the last, few days, few weeks, whatever. And so you're basically doing like a kind of regeneration on that. But what you're doing is you're re-educating the nerve to function more the way it's supposed to function, not what it's doing now. And so you see this a lot in postural issues, like misalignments, elevated shoulder, hip, inflammatory conditions, things where there's been infection or severe allergies, just like anytime things get really super overstimulated, also injuries, there's all kinds of reasons why it can happen. And so the chamomile and the yarrow will help to reduce that. The thing with Melissa, it's got this kind of weird property, like weird in a good way, is be it applied to the body, taken internally or inhaled, it reduces some of the tension in the neck, a little bit in the jaws, but it actually even impacts like the gums and the roof of your mouth and the soft palate. And again, if there is some issue with the trachea and not just the vocal cord thing, all of these are antispasmodic. You're gargling with them, you're ingesting them. That should help. But the Melissa would help to relax the soft palate and relax the muscles of the neck, but also like the trachea, the esophagus, the swallowing mechanism, things of that nature. The swallowing mechanism can get wound up, but you're already taking ANS and lemongrass, and those should help resolve that, because that's usually a byproduct of tension and spasms in the stomach itself, not the whole digestive tract, just the stomach. And so by going through and doing that, you're already kind of been treating that. And so I think that's where I would go with that. Like I would just try doing what you already have, put a drop of each into water, stir it around a little bit. Or it could be juice. It doesn't have to be water. And like gargle once or twice with it, just for a little bit, like just really moving it around, and then lean your head back and do the where you really gargle it.
Mhm.
And then after you've done that a couple times, just slowly sip the water, and do that like 3 or 4 days in a row. And let's just see if that has any sort of impact. I think it will, but if it's not that, I would say the next thing that I would examine, and we'll just do it with things that you have on hand, but there's these little tiny muscles between the ribs called the intercostals.
Mhm.
And if it's not the vocal cord syndrome, or the trachea, then it has to be the intercostals, because you're running out of stuff to treat.
Mhm. Mhm.
You know what I mean? Then you start looking at, okay, maybe there is, a lymphatic thing going on. Then you start looking at other systems, and I don't know that you're in that kind of place. I think it's just there's something mechanically off with the breathing mechanism, and keep treating those sides, those muscles, the skeletal muscles that elevate the rib cage during respiration. Even with manual therapies, they don't respond super quick, because they've had a massive stress load. So it's like they've been running on overtime for a while. And as they relax, they're also a bit fatigued. So they're not quite functioning like they should. And so treating them over a period of time is a way to like kind of nurture them back in place. Even with manual therapies, it's not something where you lay on the table and somebody goes right to the spot and then you go,
Mhm.
I feel amazing. It's
Mhm.
like, yeah, I feel like we're on the right track, but we'll see. Like, it still will take a few weeks. It's something that I treated a lot in whiplashes. And I mean, there was one case that, granted, this was extreme. Like, if I remember right, her car had rolled a few times. And she didn't really have a bunch of bad injuries, but she did injure her neck and she started having breathing issues. And, we kind of did the same thing where we went through and we unwound a bunch of things, and it was those muscles that elevate the ribs for respiration. And the injury was so kind of weird and bad that it was a few months of manual therapy with topical applications. It took a while to unwind it. And I'm not saying that that's your case, but it's just showing that it's not something that's quickly gets better. You'll start feeling like, hey, I feel like I'm on the right track. And I would say the slippery slope there is always that you feel good enough to where you stop treatment when really it needs to be treated more.
Mhm.
And I started doing things like we're just looking at different ways to treat different complications with like post-COVID and respiratory things. And so I started doing this thing where I was experimenting with putting like different forms of time and stuff on my chest. I started laughing because all of a sudden I put it on like an hour later. I was like, I feel funny. Da, 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 da. And I was like a bunch of energy started shifting off my chest and in upper back. And at first I was like, ugh. And then, like, after that kind of passed for a little bit, I expelled that energy off. It was like maybe an hour or something. My chest was way more open than it was before. And I was like, how long have I been going on doing this? And I didn't even know that I was having a little bit of an issue.
Mhm.
So almost like that treatment, you get feeling kind of good and you just go like, yeah, I don't really have an issue. And then you treat something, you go, apparently I had a bigger issue than I thought.
Mhm.
And when you're treating something like this and you start to feel better, like the thing that happens sometimes, you go, yeah, I'm kind of back to where I was, or it's like good enough. And then there was still room for improvement. And I would say as time goes by and as we get older, the respiratory tract, I think needs more work sometimes than we realize.
Mhm.
You know, it depends on how often you get sick, your stress levels, and where you live, like the quality of air. So that could be pollution or that could be allergens in the air. And just over a period of time, it just accumulates, and it happens so slowly that we don't really realize it until something kind of happens. And then you go back and you treat it and you're like, oh God, this was making me feel tired and fatigued for how long? And it was just an upper torso issue. You know, it
Mhm.
wasn't even like like an energy level or adrenals or anything. It's just the chest wasn't working quite like it should.
Yeah, I do
So
think it's muscular because
I think it's muscular too. Like I mean, I think the chest thing is going to be very helpful. I mean, you're feeling it with a little bit of pressure on the sternum, but the vocal cord thing, it's still like a muscle. Like it's just how like the paradoxical thing was in your neck.
yeah,
It's just that it's just a little bit over. Like you know what I mean? It's
yeah,
not that
yeah.
far away. And so, you know, you know, you hear me talk about like I blew the shoulder out so many years ago. And when it gets flared up, like the shoulder will hurt, but my neck will start hurting, and then I'll start feeling weird issues in like the swallowing mechanism, like kind of deep. And so sometimes like the injury to like the vocal cord or the shift in the vocal cord isn't even from the throat or from talking or from coughing. Sometimes it's a muscular misalignment or like an inflammation or a spasm somewhere in the shoulder girdles that then will manifest up in that area. And like when I calm the shoulder down, the thing in my throat goes away. You know,
Mhm.
there was one time, it was just like about a month ago, I thought I was starting to get sick. I started taking like Bay Laurel and I was like, boy, nothing. Treated my shoulder, it went away like within 24 hours, like 24 hours. It was, and so, you know, you just start correcting these things, but you've corrected a bunch, you've treated a bunch. So like now we're getting to like the weird, odd things, you know, like the skeletal muscles for the rib cage, the vocal cord issue. Um, that will also address spasms in the trachea. When I look at your trachea, it doesn't look too tense, but sometimes what happens with the trachea is there'll be like a little section where it's like most of it is fine, but there's like a spot. You know, just like if you had a cramp in your back, like you'll get like a little like tension area in the trachea, and it will throw off the whole breathing mechanism. And so this should address that as well.
Okay, so the ANS support and lemongrass, I've been taking that internally for about 3 weeks now.
Mhm.
Is there a limit on that, or do I need to
I'd
take a break
say
from
take a
it?
break maybe in 20 to 25 years.
Oh, okay,
No,
okay,
you're not going to need to take it that long, but it's like it's one of those things you could take super long term.
okay. And then
Yeah,
I
that's the deal.
added time linalool
Oh, nice.
to
You got a
help
great
with
combo
my
going.
stamina.
Yeah.
And that man, that worked instantly. It's incredible.
Isn't it nice? And it's gentle. Like that's the thing that I love about Tylenol. By the
Yeah.
way, that's what I rubbed all over the chest and alcohol. Put a bunch of Tylenol and alcohol and rubbed on my chest. I was like, oh, this is relaxing. And then, you know, because it does increase blood and loosens up the muscle. And then all of a sudden I felt like something moving. But my energy levels have been better since. They weren't bad, but it's always nice to have a little improvement, you know. And
And how
uh,
long can you ingest time?
that particular time, it's same like the ANS and
It's
the
okay.
lemongrass. Yeah,
Okay.
you could take it super long time.
Okay.
the no pun intended there. The
Yeah.
the more intense times I would give yourself a break, like red time, white time, things of that nature. I would say a couple weeks and then a week off, but like time Thuyanol, time Geranol, time Linalool, have at it. Like
Okay.
you go for quite a while.
And I had always heard that you're not supposed to ingest Melissa, but you're saying it's okay?
Oh yeah,
Okay, all right.
yeah.
Um,
You know why they say that?
no.
Most of the Melissa on the market is fake.
Oh, okay.
Yeah.
Okay.
Like we had, is it okay if I talk? Yeah. So, many years ago, Samantha, was exposed to Melissa from somebody else, one of the big companies. And she was like, I hate Melissa. Ugh, it's nasty. And then she smelled it, and the Melissa that I had, she would never smell it because she was like, I can't stand Melissa. And then she smelled it and she goes, wow, this is really nice. She goes, I wonder how it's different. I was like, well, it's real versus like the fake thing. I mean, this is the extent that they do it. It's not just that it's like partially manipulated or synthetic, because it is one of the more difficult oils to get, period, because the yield is so low. And so basically people get on lists with a distiller and they're on that list for a while, that like when you distill, I get this amount every year. And you take it whether you need it or not, because if you don't take it, you're off the list. And sometimes there's a list to get on the list. Like that's how precious this oil is. And so a lot of times what ends up happening is you buy it from a broker or something because you're not on the primary list, right? And so people will make fake versions of it. They'll make manipulations of it. But what they'll also do is they'll take lemongrass, lemon, and citronella, which are all relatively inexpensive oils, and they'll blend them together to make a Melissa blend. And so it smells almost identical to normal Melissa, but it doesn't have the therapeutic properties that Melissa does.
Gotcha.
And so a lot of the Melissa on the market is that Melissa.
Gotcha.
Good
to know.
Yeah.
I need some